Okay, so we're going to work on the lower extremity, and how we always want to start is a functional weight-bearing assessment of some sort. We want to look at a structural assessment. So what I like to do is you can start at the bottom, look to see if there's any hallux valgus. Hallux valgus means you're not really good at pushing off, the push-off phase of gait. That could be anything from a palsy in the peroneals, causing increased pronation of the foot. It could be a rigidity somewhere along the line, whether that's a hip causing you to pronate, something biomechanical going on. But then we want to know, outside of the hallux valgus, what's this person's setup? So go ahead and bring your feet together for me. So you'll notice that, she definitely doesn't have genu varum, maybe some slight valgum. Go ahead and bring your feet shoulder width apart now. And feet are a little bit flatter, and she tends to turn in a little bit on this side. So it's a little bit more of a mobile body type as compared to some people who are pes cavus. Then they're genu varum. So they're a little bit more of a rigid body type. Now for you, go ahead and turn to the side and extend your knees. Good. So she has a little bit of recurvatum. Does your thumb, okay? Okay. So we already know that, and then when you bend forward, can you touch your hands flat? No, she can't. Okay, good. So, but there are some aspects where she's on the more mobile, and then your elbow. Okay, and then your fingers. Yeah. So she didn't have the feet flat, but she is higher on the Baton scale. So that is already, she's going to have a hard time controlling her neutral zone. One, and number two, you've got to be careful when you're going into any kind of manual therapy where you're trying to get range. But at the same time, if she has something that's super stiff, she's going to borrow like a son of a gun from other areas. So then we want to address that stiffness if it's a true stiffness. So go back and, then as far as the lumbar spine is concerned, she doesn't sway too bad. So that's not too bad. She hyperextends here. She tends to rotate in, but she doesn't seem to be borrowing it from her back too much. So that's part of that structural assessment. You need to know the foundation you're working with before you move on. You can do other tests for functional weight bearing that we add, which are, go ahead and turn and face me this way, sir, and just go ahead and just do a squat for me, and then come back up, and then go ahead and stand on one leg for me and do a little mini squat, come back up, and then the other, do a mini squat, come back up. Doesn't like that one quite as much, but that's good because we got to work on that, because anytime she's putting weight through that left leg, she's not happy. So then that there has to be some neuromuscular control. Any ankle sprains, anything like that?
I broke my talus and sprained my ankle.
On the left side? Yeah, and how long ago was that?
2016, 2017.
Okay. And how rehabilitated do you think you are from that?
I still have like stiffness and weight bearing. I can't dorsiflex as much on the left as the right.
Okay. And so another test we can do on your right leg, can you do 5 hops, single leg hops? Good. And let's do the other side. How's that on that side? A little harder on that side. If we were worried, if she fractured her talus and we were worried more about high ankle sprain and recovering it, did they do surgery? Okay.
It was a very small fracture.
Okay. But if you were worried, if there was enough momentum for that, then there might be enough to displace the inferior tib-fib ligament, and the single leg hop test will cause some of that splaying. And if they're like super not controlled on one side compared to the other side, then there might be an aspect of bracing or taping you would want to do. And we could start making some hypotheses. and I don't know anything about her background, but you could tell there was something going on that left side. We saw it with the Portland test, we see it with the single leg hop test, and then also we saw that she's on the more mobile aspect of the spectrum. So those are going to have to be a framework we work with when we move into our lower extremity exam. Also our lumbar spine exam, we should be making that structural assessment of people the whole way when we're going through our system. You can do the climber's test, which go ahead and bring one leg up on here. Maybe I should, which is a nice test, the climber's test, just because we can look at hip flexion on this side, hip extension on the other side, and go the other way. Good. And then come back. So that's a test you can do. When we go back to the squat, so go back to the, when you do the squat test, don't go as far down, but go ahead and squat. Good, and shift this way. So we look to see if she increasing here and shift the other way. Feels different this way compared to the other way? Yeah, so she doesn't shift over more there. So again, we start making predictions depending on what she does. What do you do for exercise?
I did a lot of swimming, but not so much anymore.
Oh, okay.
Now I'll do some running, but not too much strength training anymore.
What was your stroke?
Backstroke.
Backstroke. Ah, that's awesome. So my son was a swimmer for a while, so his was breaststroke and butterfly. So, but those are important questions, because if you do have an exercise program, then we would go to that to see where we can make you stronger within that. But limited dorsiflexion on this side, limited load transfer on this side with a more mobile body type. That's what we have, and a history of trauma. So that's our framework and our mindset before we go into this exam for the lower extremity.